Can you share how implementing this virtual assistant, this healthcare virtual assistant in your clinic, has helped you address similar challenges to those patient interactions and retention now?
Yeah, absolutely. So, I'll to share specifically about kind of my experience with my VA, Angelo. I call him kind of the Swiss Army knife. He is somebody who really is able to be very flexible and adaptable, and he's also very hardworking, kind human being, and learns quickly. Some of the roles that he functions are as follows. Some days he will be my receptionist due to the proliferation of technology with my phone, faxes, my patient engagement tools, my electronic medical records in the cloud. Even though Angelo is in the Philippines and we're in the States, he's able to act the role of somebody who's actually physically here. And so he is on days where I'm actually in clinic by myself seeing patients. Angelo is able to man the phone and kind of work the administrative aspect of it while they focus on patient care. And on days when my other staff is here, he is able to kind of fall back and work in the background, checking eligibilities for patients' insurances, assessing balances, and following up on claims with insurances, and working on faxes, referral coordination, surgical sign-up coordinations, etc. So he's able to be front and center and able to kind of work by falling back into the background. Lastly, he's also been kind of my problem solver. One of the things that kind of an example, it would be we had this issue with insurance companies bombarding our communication, whether it be via fax or phone, about requests for medical records so that they could review and kind of see if there was opportunities to change coding so that they could be reimbursed even higher as it relates to specifically Medicare Advantage plans. Well, these people are very persistent and they're very motivated to do so. But when you're getting 20, 30 faxes, in a month about the same different number of chart requests, and to be able to kind of organize that and to be able to kind of make sure that those things go out in a organized fashion, very challenging on top of kind of managing everything else, especially focusing on patient care. Well, I tasked Angelo with that, and he came up with a tremendous system using the Google version of Excel sheet to keep track of all those requests and to be able to kind of submit those records in a timely fashion. So that was a tremendous feat in my